Having a high-risk pregnancy means that, due to a pre-existing health condition, or one you develop during pregnancy, you may have a greater chance of pregnancy complications. Because of that chance, you'll need extra monitoring, and perhaps extra treatment to make sure everything goes smoothly with you and your baby's health. However, having a high-risk pregnancy diagnosis doesn't mean necessarily that you'll have problems. In this video we are talking about high-risk pregnancies, and you are going to have some excellent tips to cope with bed rest if you have no other choice. Ready? Let's begin. The most common reasons why you might be classified as a high-risk pregnancy are 1. Insulin-dependent diabetes. 2. High blood pressure. 3. Any signs of premature labor such as abnormal bleeding or pain. 4. Pre-existing medical conditions such as thyroid problems, heart disease, history of cancers, etc. During this time it's crucial to know exactly what your doctor means when he recommends bed rest. There are different types of bed rest. The mildest means just avoiding excessive physical activity, staying in bed for as long as you can, and probably also recommending pelvic rest, which means avoiding sex. The more literal term of bed rest means not to get out of bed for any reason, unless you go to the bathroom or kitchen, and walking slowly. This second probably also includes the pelvic rest as well. If you have to be in bed rest, here you have some good tips for make the best out of this time. 1. Set up your room to be extra functional and comfortable. If you are forced to stay in bed, you must create a very comfortable bed and room space. To spend the remaining days or weeks of pregnancy, some changes may be necessary from the beginning to make you feel distracted, comfortable, and happy. 2. Count your blessings and stay positive. Rather than regretting what you are missing, this is the perfect time to think about what you are enjoying. Motherhood is a beautiful miracle. Take advantage of this time to read books to your baby, and connect with yourself, and with that little person that is in your womb. It is the time to enjoy relaxing music, a smell that you like, to start a journal, if you have not started one, to keep track of your pregnancy and emotions. All these things will make you feel better and happier even when you are confined to your room. 3. Lean on your partner. The bed rest can have two different effects, or it can unite you as a couple, or can separate the marriages even more. During these difficult times, consider being sympathetic to your partner. While you are confined to a room, he is carrying the burden of the rest, and probably providing financially to keep things afloat, in addition to the remoteness that the bed rest imposes for prohibiting sex, or others physical activities that you share and enjoy together as a couple. Don't be afraid to express your feelings, and communicate with him. Being loved and cared by a sensitive husband right now is going to help you connect more with him, and is going to take your relationship to a new level of rapport that you have never experienced before. 4. Keep house rules crystal clear. From the beginning, consider having a family reunion to make it clear that things should change from now on. This point applies specifically if you have children. You must explain to the little ones that your role as a mother is on hiatus for a few months and all for a good cause. If you have children under the age of 4, consider hiring a babysitter if you can. 5. Keep your mind busy. Just because you have to be physically inactive does not mean you have to be mentally inactive as well. In fact, during this downtime, your mind and emotions will be more active than ever. So if you can keep your mind active and busy with work or other things, that will help you a lot. Activities such as paying the bills, help children with homework, work from your computer, etc. will be a good idea. 6. Stay fit while in bed rest. The most wise thing to do is to consult your doctor first. After his consent, try to exercise some of your muscles even if you are in bed rest. Within bed exercises, you'll find leg lifts, calf stretches, and upper arms exercises with lightweight lifts. All of these exercises promote circulation, keep your heart active, and maintain muscle mass and strength. 7. Perfect time to pamper yourself. Being in bed rest as a result of a high-risk pregnancy does not mean that you have to neglect yourself. This is the perfect time to hire a massage therapist, do a manicure or pedicure at home, perhaps ask your hairdresser if she can come to your home during this time, etc. You can always find ways to feel beautiful, even if you are in your room. 8. Choose your visitors wisely. Being in bed for long periods of time can make you crave adult conversation. However, only invite those friends who will listen to you, and will be empathetic to your situation. Pick those friends that understand you, that make you laugh, and bring you happiness, contentment, good energy, and positive vibes, not the opposite. 9. Get professional support during bed rest if you feel that you need it. Being in bed rest is a very frustrating situation. Don't hesitate to contact your healthcare and ask if they can provide you with information about support groups in your area for mothers in your situation. Here you have some good tips that will allow you to feel better if you have to be in bed rest. If you enjoy this video, share with us in the comment section if you have any experience with bed rest in a high-risk pregnancy. Also subscribe to the channel if you want to see more useful information about pregnancy and motherhood.